Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So I regret to inform you that since I last reported a week ago, we've had 4 deaths in a long-term care facility, Simcoe Manor. When I reported last week, we had 1 death of a confirmed case, and there were 2 others that were under investigation as possibly being cases. So those were confirmed as cases. We've had another individual who is considered to be a confirmed case who passed away, and another individual who has passed away who is under investigation. It could possibly be a case. So my condolences to the family members for your loss. As of this morning, we have a total of 1,083 cases. So this is a very large increase over a 1-week period. It's an increase of 127 cases. And I'd like to make a comparison with last week, where we had 62 cases reported in the week. So that's more than twice as many cases compared with the previous week. And if we look over the weekend, from Friday through the long weekend, we had a total of 55 new cases. So if we look at these most recent cases, they are as follows. 5 of them are related to the outbreak at Simcoe Manor, and 1 of them is related to the outbreak at Bradford Valley, and I'll be getting into more information about our outbreaks later on. 2 of them are associated with an outbreak at an agricultural food processing plant, a workplace, and 47 of them are sporadic cases. 30 of them are male, 23 are female. 2 of them at this point we don't know. It's part of the investigation to find that out. We've got an age range among our cases of children under the age of 10 to individuals in their 80s. 53 of them reside in Simcoe County, and 2 of them reside in Muskoka. If we look at how they were acquired, 11 of them were acquired in the community without a known link. 24 were contacts of cases. 6 were part of institutional outbreaks. 2 were part of workplace outbreaks, and 12 are under investigation at this time. 47 of these are in self-isolation. 3 have recovered, and 5 are recovering within an institution, part of institutional outbreaks. We've also continued to have exposures in schools, so we've had no transmission in schools that we're aware of to date, but we've had a total of 25 cases involving 24 schools where an individual was identified as a case and had an exposure at the school, resulting in a large number of people having to be isolated and followed up and recommended for testing. Just going to make a few comments about our outbreaks. So we have right now 4 institutional outbreaks. That's up from 3 a week ago. So one of them is at IOOF in Barrie. This has been ongoing. We've only got 1 staff member as a case there. Residents and staff have otherwise tested negative. And it was declared on September the 26th. So so far we've done well in avoiding further transmission in that situation. At Bradford Valley, we have 2 staff members who are cases and no residents who are cases. We've initiated testing at that site. This outbreak was declared on October the 7th, and we're awaiting test results at that site. But so far, we've had no further evidence of transmission. We have a an outbreak at a group home in Simcoe County with a staff member who is a case, but no other cases, and so far that's under investigation. Testing of all individuals at that site is taking place. That was declared on October the 7th. Our largest outbreak by far is Simcoe Manor in Beaton, Ontario, Simcoe County. And to date, we've had a total of 48 cases, up from 28 cases a week ago when I reported on this outbreak. This includes 19 cases among staff, up from 7 when I reported before, and 29 cases from among the residents, up from 21 cases a week ago. We have 1 individual who's hospitalized, which is actually down from 2 individuals hospitalized a week ago. And as I had said before, we have a total of 5 deaths, 4 in confirmed cases, and 1 in an individual whose testing we're awaiting results. We've swabbed, tested all of the residents with results pending. We've got 122 staff who've been tested with negative results. And at this point, I would really like to commend the efforts by multiple agencies to come together to assist with this outbreak. It is a serious outbreak, and it has certainly been well supported by Simcoe County as the operator for the facility, and they had put out a request for assistance, and so we've received assistance from RVH. They've put in place management and leadership for the facility, and infection prevention and control expertise, and now making requirements with regards to infection control and cohorting and monitoring and testing and follow-up for potential cases, overall management of the outbreak, and have brought in their own expertise, including medical expertise, to assist with the response, to provide leadership to the response. We've also had, on an ongoing basis, support, including medical support from Stevenson Memorial Hospital as well, and infection prevention control support. And as a health unit, we are very much involved in the management of the outbreak as well. So I would like to commend those agencies in coming together to help manage this serious outbreak. With regards to our workplace outbreaks, as I'd mentioned before, we have 2 of them right now. One of them is a manufacturing facility in Simcoe County. We have a total of 4 cases in that outbreak. 3 of them are of individuals who live in Simcoe County, and 1 of them is an individual who resides out of jurisdiction. So the case count will only, on our website, only include the 3 who live here, not the 1 that is out of jurisdiction. They would be counted in the statistics for that health unit. And we have an ongoing outbreak at a food processing plant, also in Simcoe County, declared October the 5th. A total of 17 cases, up from 5 when I last reported. 3 of these cases reside in Simcoe County, and the rest of them reside in other jurisdictions, and so they wouldn't be included in our case count. Instead, would be included in the case count of those other health units. And testing is being done of all the staff who work at this facility. So at this point, I will turn to my media questions and key points that I want to raise. So I noted a week ago that we were going to be launching a dashboard on our website that would be, at a glance, a tally of how we're doing overall. with a scoring system based on colors of green, yellow, and red, and that way you'd be able to tell at a glance how we're doing overall. It would provide an overall sense of how we're doing with the pandemic. It provides a sense of the trajectory of the pandemic, the direction that we're headed, and could be used by stakeholders and members of the community to make their own decisions. For example, healthcare facilities, hospitals could use it to make their own decisions about the protection of their facility and the avoidance of transmission in their facility, measures that they could take. So if you look at that, it's on our website right now, and it's broken down into the following categories: indicators of viral spread and containment, laboratory testing, the turnaround time for testing, healthcare capacity, for example, the degree to which ICU beds are available, and the occupancy of the hospitals in our jurisdiction, and also public health system capacity, so our own ability as a health unit to follow up with our cases and our contacts in a timely fashion. With regards to the current situation, we've got an upswing in our non-institutional outbreak cases. It's one of our indicators. So that is certainly higher than it had been earlier in the month and in August. We've got a reproduction number which has been above 1 since late August, when it was 1.2. So that's an indication that the pandemic is continuing to climb here. We have something that we call the percent positivity, which is a measurement of both the number of cases that we're getting, but also the amount of testing that we're doing. And it's a standard that it be less than 3%. If it's above 3%, certainly it's of concern, or if it's increasing, it's of concern. Ours was as low as 0.3%, and it is now above 1%, which is higher than it's been since May, and I think would reflect both the increase in cases, but also reduced access to testing, or the slower turnaround time that we're having in testing. And we also note a challenge in our ability to follow up with our contacts. So the percent of our high-risk contacts that we've been able to reach within a day is below 80%, which is lower than it's been since August. So this is something that I had identified a week ago, a reason why we're taking a change in our approach with contact management, that we're challenged with the number of contacts to be able to follow up with them all in a timely way. So if we look at the overall scoring on our dashboard, we put ourselves at a yellow, which is needs attention. And that breaks down into the 4 categories. So with regards to viral spread and containment, we consider ourselves yellow. With regards to laboratory testing, because of a lag in testing, we're at red. With regards to our health system capacity, with high hospital occupancy at this time, not from COVID-19, but just in general, there's hospitals are up and running, and at a high occupancy, we got ourselves as yellow. And for public health system capacity, red, because of our lagging ability to follow up with our contacts. Some media messaging that we've noted lately, there's been some question about the accuracy of testing, or the degree of sensitivity of testing for the nasal swab PCR testing. There is a challenge online about the CT number, cycle number that we have set that the allegation was that it's set to be too sensitive, that it's picking up potentially false positives. What I would say about testing is that the accuracy of the test in part depends on whether or not you actually fall into a group that needs to be tested. So for a long time now, I've been advocating that people should be going to get tested if they have symptoms or they've been a contact of a case. And under those circumstances, if you have a positive test result, it's very likely to be a true positive, to be accurate. Whereas if you go for a test but you don't have those indications, you're not having any symptoms and you haven't had contact with a case, then for one, the likelihood of you coming back with a positive test is probably going to be about 1 out of 1,000. And if you do come back with a positive test, there's a high likelihood that it's not a current, true positive test. It either reflects that you had an infection in the past, but it's not current, or that it's even a false positive test. So this is just the nature of testing in general, that tests are far more accurate if they're done on people likely to be positive than if they're done on people who are very unlikely to be positive. So to me, the practical thing is that people should be seeking testing if they have symptoms, if they have been a contact of a case, and then the province has other indications requiring testing as well, such as a precaution for those that work in long-term care or those that are visiting long-term care. There's been some online discussion about cloth masks, and my order to the community requiring people to be in self-isolation and seek testing if they have been diagnosed as a case, or if they are a high-risk contact of a case, or if you have symptoms compatible with COVID-19, that you need to apply the province's screening tool and follow the directions that are provided. So one of the things we note is that a high-risk exposure is an individual who's been within 2 meters of a confirmed case for 15 minutes or more, and has not been wearing personal protective equipment, PPE. And by personal protective equipment, we mean a surgical mask or procedure mask, a medical mask, medical grade mask, and also eye protection. And so the question has arisen, why do you insist on a medical mask and not a cloth mask? How come a cloth mask wouldn't be considered sufficient protection? And what does this say about the province's requirement now, not just my requirement, but the province's requirement that people wear a face covering in indoor public places and workplaces? So my response to that would be that medical masks are indeed more protective than cloth masks, homemade masks, or masks that are not considered to be medical grade of quality or protectiveness. And in fact, we've always said that the protection that they provide are actually for others. The cloth masks won't really protect you from exposure to other people. They'll protect other people from you, that they catch the droplets that you breathe, but that they allow for absorption through the mask of other people's suspended viruses in the air from their own droplets. So therefore, we couldn't really rely on a cloth mask to protect you if you've had an exposure. And they're not as protective in general as medical grade masks, even from the point of view of protecting other people from you. A medical mask would be more helpful from that point of view as well. So we make this distinction, and we note that full personal protective equipment is sufficiently protective that we wouldn't consider people who've been in close contact with a case to have had a high risk exposure, but we deem that a face covering, a cloth mask with that kind of exposure is not sufficiently protective. We make that distinction to be protective of people. We don't want to miss any cases, and therefore a cloth mask, although it is a good idea to help reduce transmission in the community in general, therefore required, it is not sufficiently protective if you've actually had that kind of close encounter. We have a new section on our website, COVID-19 website, that provides instruction about what to do if you've been exposed to COVID-19 and provides you with linkages to useful tools such as the province's screening tool and other information about how to follow up with isolation and testing. So I certainly would like to encourage people to use that resource. We've had ongoing questions around Halloween and Halloween messaging, so we do have some information now on our website that I would encourage people to look at as you consider preparations for Halloween. So first off, people should not be going trick-or-treating. Children should not be out trick-or-treating if they have symptoms, if they're unwell, or you shouldn't be at the door providing treats if you are unwell. I would also say that people always have the option not to trick-or-treat. Children have that option not to go, and households have the option not to actually participate in Halloween and trick-or-treating. If you feel vulnerable, if you have a pre-existing medical condition, then that would be a good reason not to participate in Halloween. We would also say that those who are trick-or-treating need to stick to their household as they go around the neighborhood. They need to wear a mask, and not just the costume mask, but a proper face covering as well. Same with those who are providing candy at the door. They need to be wearing a mask. They need to be physically distancing. If you can find a way of handing out the candy that allows for physical distancing, such as the use of tongs, that is a good idea. And that you wouldn't be congregating or lingering at doorways as groups, avoiding the crowding that could happen. There's also hand sanitization would be a very good thing as well, essential in your encounters with regards to trick-or-treating or for those that are providing the candy at the door. So there might be more information coming. We anticipate more from the province. It's possible that these recommendations will change depending on the epidemiology, depending on the amount of transmission, circulation of the virus, the level of activity. There might be changes coming from the province with regards to the approach to Halloween this year. We are very much on the incline provincially in the Greater Toronto area, in the Ottawa area, and here in Simcoe, Muskoka, definitely increasing quite quickly with regards to our cases, so this could change. And I always like to go back to the key messages, which is we need people to stick to your households and not be gathering in larger groups, that you need to maintain your physical distance from all other people, the 2-meter distance, the setback from other people, and need to be doing hand hygiene and self-monitoring and self-isolation if you develop symptoms, and seeking testing if you develop symptoms, in using the Ministry of Health's self-assessment tool to help guide you in that deliberation, in that process. So all of that will always be important throughout the duration of the pandemic. So some questions that we have are as follows. Can you discuss when and how the Health Unit hopes to get back into full contact tracing? I would say that we're doing our best to do it now, but as I'd said before, we with our large numbers of contacts associated with the schools have had to rely on the schools to do that outreach with a letter from ourselves that they transmit to parents by email and follow up with telephone discussion, consultation, and we advise people to call us as needed. So we're going to continue to rely on that. If necessary, we'll be asking people to do follow-up with their contacts if they have a very limited number of them and they feel confident in being able to do that. We've got Public Health Ontario now providing a service to us, doing about 20% of our contacts for follow-up. So that's an excellent service. We're very happy to have that underway. We are continuing to hire more staff, and therefore we'll do the very best of our ability to follow up with all of our contacts, but we are seeing this tremendous growth in our cases, and with that a growth in our contacts. So I think it will be some time yet before we be able to get back to us doing all of our contact tracing ourselves as an agency. So what impact could limiting full contact tracing have? There is risk in not being able to follow up with all of the contacts ourselves. That the information that people need who are contacted by some other means, through the school or through their own cases that they've had contact with, could be incomplete. Two-way communication is always better, so that people can have their questions answered, and so we can better assure that they fully understand what's needed of them. So a risk would be that they don't, in some instances, not understand what's needed or what's happening, and they don't abide by the control measures, they don't abide by the self-isolation or follow-up testing, and there's a potential they could emerge as a case and lead to more transmission in the community. Obviously, we want to limit that as much as possible. We want to get back to as much of full contact tracing as we can, but at this point in time we're limited in our ability to do that, and we're having to make trade-off decisions to use these other means. Are the long-term care facilities in Outbreak right now getting the additional supports they need, and can you describe these supports? So the key, most of the outbreaks that we have are very small, but we do have the one at Simcoe Manor, and that is large in size, and therefore also impacting on the staffing in that facility. We've had a large number of the staff off as cases, so that becomes a challenge to the facility to be able to operate. We've got a lot of additional support from RVH, for which we're very grateful, expertise on infection control and infectious disease and outbreak management and leadership on outbreak management. And so we've benefited greatly from having that in place. We continue to benefit from having the support also from Stevenson Memorial. Simcoe County has been very diligent in following up on getting more staffing to be able to provide the direct care required to the residents, to ensure that we have a sufficient number of staff to provide the care that they're going to need. And they've used paramedic service personnel as well to assist with that. So this is a situation that's demanding and requires a real team approach among agencies. We as a health unit providing our own direction and support as well. So it's going to require this kind of team approach for some time to come. And there's no doubt that it is a demanding situation. So what are at what point is the decision made to ask a hospital to manage the facility? What does that mean? And what is the health unit's role if RVH takes over its management? So as a health unit, we're very much accountable for a response to the outbreak. We have legislated authority to know of outbreaks that have to be reported to us. We have programmatic requirements from the province that we respond to outbreaks, that we ensure that the facility organizes itself and does all that's needed to be able to track cases, to continue to report to us all cases, to put in place control measures to reduce transmission or avoid future transmission in the case of outbreaks. And this has been very much a part of our mandate for many, many, many years. We look at all outbreak situations, and one of the key questions for us is the facility able to manage this outbreak? Do they have the resources that they need? Are they overly challenged with the size of the outbreak that they can't manage? They don't have enough resources, that they need the assistance of another agency. And it's been very much the experience in the province with COVID-19 that there's a high likelihood that a facility can be overwhelmed with the response, that they lose too many staff and they have too many cases with a high mortality rate among those cases, and need the assistance of another agency. And in many instances, this has been hospitals that have played this role, both in the first wave and now again in the second wave. So as a health unit, we are looking at the situation and assessing whether or not there is the need for that additional resource. And I would say that Simcoe County, as the operator, identified for themselves that they needed additional resources and sought that with local hospitals and with the Central Region of Ontario Health and the Local Health Integration Network. They sought that out themselves. We identified that they were correct. They needed that additional assistance, and so RVH was appointed the task of leading further in the management of the outbreak and providing the expertise that they could, while the other parties continue to provide their support, and that very much includes Simcoe County. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. Let's start with Marge Bruneman from Barrie Today. Are you on mute, Marge?
I was. Sorry. Thanks for the question. I'm willing to ask the question. I am wondering, is the health unit getting all the help it requires or really needs from the province and federal government in its approaches to COVID, and not just the outbreaks, but the positive infection numbers?
Thank you for that question. It's a very big question. I could look at that in a number of ways. From a resourcing point of view, the province has pledged to reimburse us for the additional costs associated with COVID-19, and we've assessed those costs and submitted our request for that, and they've also given us a budget earlier in the year that was supportive. So I think we're okay in that regard. We could no doubt use even more resources because we've fallen short greatly on the provision of our other programs and services. But I think that would be a common challenge among all health units. The province also plays a key role in providing guidance documents and expertise, and they've done that to an enormous degree. There's been repeated documents that have been put out with regards to the management of COVID-19 in general, its management in long-term care facilities, its management in schools, the case definition, the testing protocols, tools for members of the community to assess themselves to determine what they should do, whether or not they need isolation and testing. The province has played the role of supporting the creation of assessment centers to allow people to get tested. That's, of course, been very much done in partnership with the broad healthcare system and all the players in the healthcare system in communities. So we've had excellent support from hospitals and family health teams, community health centers, paramedicine in order to establish assessment centers, but all of that has been done with the support of the province and with Ontario Health and the Central Region of Ontario Health. The province certainly has been the lead about what we call public health measures. So when they closed venues and businesses in the spring and placed limitations on public gatherings, and put out strong messaging about people staying to their households, and otherwise the physical distancing messaging. That was all absolutely critical in bringing the pandemic under the control that we had in the summer. And now, as they do so again with the second wave, the control measures that they put in place in Toronto and Peel and Ottawa are certainly very important there. The gathering limits that they put in place across the province right now, again, limiting people to no more than 25 people getting together outdoors or 10 people indoors is critical. All of those things are various ways that the province is responding to the pandemic and supporting us as health units in our response to the pandemic. It's not none of this is easy, of course. The testing system has been, of course, very much their leadership as well, not just the assessment centers, but increasing the laboratory capacity in this province has been led by the province. We are experiencing a second wave, so the leadership the province provides right now is critical. I anticipate there'll be more control measures to come as the numbers keep going up and affecting a broader geographic area than was the case even a week ago. All that leadership continues to be absolutely critical, and can really not come from anywhere other than the province. Locally, we do our very best to implement what the province is doing, and if necessary, I can issue orders to go ahead of what the province is doing. But for the most part, it's the province's leadership that has enabled the success that we've had to date.
Thank you, Mark. Do you have a follow-up?
I do. I'm wondering, you had mentioned, for instance, with contact tracing, getting more help and hiring more people. At what point is the expertise available exhausted? I mean, are there still people out there available to do that kind of work?
Yeah, it's true that hiring more nurses, for example, can be a challenge. Although we've actually been very successful with our recruitment to date. The province pledged to us hiring 26 additional nurses, primarily for our work in schools, but those nurses are indispensable to us for case and contact management, both in and out of schools. So we've had success in recruiting them. I understand that there can be difficulty in recruitment of healthcare professionals in other environments, such as hospitals and long-term care facilities, that may be related to the present stress of working in those environments, and also because everybody needs them all at once. But we've actually done fairly well, at least here locally, in being able to recruit here in Simcoe Muskoka District Health Unit.
Thank you.
You're welcome.
Great, thank you. Ian McLennan from Barrie 360, do you have a question?
Yeah, I was going to follow up with what March had asked, but the flu shot, we've had some people contact us saying they're having difficulty accessing a flu shot, some waits, and I'm just wondering if the health unit will be tracking wait times to get flu shots at pharmacies, et cetera, to make sure that it is available, and especially in light of the pandemic.
So at this point in time, it should be something available for those who have pre-existing medical conditions that put themselves at a higher risk. And later on, more broadly to the entire community, it does become available in installments rather than having enough for everybody all at once. And that's normal. That's what happens each year. I do anticipate there'll be a much bigger uptake of the vaccine this year than in past years, and that's a very good thing. People need to avoid getting influenza always, and certainly in a year which you have COVID-19 also circulating, you don't want both at once, or the confusion of having influenza and not knowing if it's that or COVID-19. We did some preliminary work to determine availability of practitioners to provide the vaccine. At my request, the Central Region of Ontario Health did a survey of physicians and determined that most of them would be willing to provide the vaccine as they had in the past. And we also found that a high number of pharmacies are willing to participate. So those are good indicators about the system and its openness, having capacity to provide vaccination. Indeed, we want to know how vaccination goes as it transpires. We do provide vaccine to family physicians, and so we would be able to gauge the uptake with regards to the amount of vaccine that they're taking from us as one of the early indicators of uptake.
Okay, thank you very much, Doctor.
You're welcome.
Thank you, Ian. Dawn Huddlestone from the Huntsville Doppler, do you have a question?
I do, thank you. I'm wondering if we can go back to the new monitoring dashboard, Dr. Gardner, and looking at the technical descriptions. A lot has to happen to push that into the red zone, at least for the virus spread and containment. So I'm wondering what kind of action is going to be needed if we do see things get that bad.
We will need the province to proceed with more control measures if it keeps going up. So right now the province has done that in Toronto, Peel, and Ottawa. And I know that they are monitoring their data closely to decide where to go from here. And I have learned that they are actually going to be putting forward their own reporting tool. I was told it was within 24 hours. That would be a very good thing. Then you'd have a more of a concrete sense as to how they're approaching it. But if our numbers keep going up, and they are going up quickly, so I do not doubt that they will go up for a time before they come down, we'll need more of the kind of control measures that they put in place right now in Toronto and Peel and Ottawa.
Thank you. And, sorry, I do have a follow-up. Here in Muskoka in particular, and may have been the same in other areas, we have a huge influx of people over the Thanksgiving long weekend. Do you think we're reaching a point where people in high transmission areas need to be asked not to low transmission areas?
That was certainly the case in the spring, and in fact, just last week, the recommendations from the province, in addition to sticking to your household only for Thanksgiving dinner, was not to travel unless you had an essential reason for doing so. And that was meant to support the idea of sticking to your household and not going to other households and other jurisdictions, and therefore not transmitting the virus from a high incidence location to a lower incidence location. So the message is already there. I think it needs to be reinforced and coupled again with whatever additional control measures the province puts in place in the future, probably in the near future.
Thank you. Okay, thank you.
You're welcome.
Chris Simon from the Very Advance.
Thank you very much. Dr. Gardner, while you were speaking, the county of Simcoe has actually sent out a press release saying that to date, 34 Simcoe Manor residents and 20 staff have tested positive for COVID-19, which is above what you reported earlier. Can you explain why there is almost daily a difference between the number that you guys are reporting and what the county is reporting?
Well, I get my data from my staff. They seek to make it as current as possible, but when cases are going up day by day, there can be a lag, even if it's just an hour or two, in the data coming to us, getting inputted into our data system, and then being given to myself to report to yourself. So when something is going up fairly quickly, you can get that kind of a lag.
To your knowledge, is this the first time that a hospital in Simcoe Muskoka has had to step in to take over an outbreak at a long-term care facility? In
for the first wave with Owen Hill, RVH provided that kind of support as well. And with Bradford Valley, Southlake provided a lot of on-site testing as a means of support. So that kind of thing has happened before here in Simcoe, Muskoka.
Okay, and so it was through an official order, or was it just as a support measure?
So this time it was done as an order from myself on Friday under the Health Protection and Promotion Act as a means of facilitating it happening quickly and meant to be a support. Simcoe County had already put out the request for assistance, and this really assisted the legal means of having it in place, having RVH being able to provide this kind of management.
Thank you.
You're welcome.
Okay, thank you, Chris. James Bowler from Cogeco, go ahead, please.
Thank you. Dr. Gardner, just following up on Allison's question about people traveling to Muskoka. And this may be the unpopular opinion, but I'm just wondering, the province has put in place restrictions on restaurants and bars and gyms and the like in hotspots, but, people clearly don't, a lot of people disregard this messaging, whether they're told to travel elsewhere or not. So I'm just, should there not be more stricter things put in place, maybe as far as putting this restriction in all bars and restaurants in the province, or even having some kind of check-in at the door to make sure that people who are coming from hotspot areas are not being allowed in these other restaurants?
So it's entirely possible that in the near future the province will extend these same restrictions about restaurants and bars and gyms, theaters, etc., that are in place in Toronto, Peel, and Ottawa. That's entirely possible that will come soon, though that is very much the call of the provincial government. And so if that happens, then that will indeed be in place in Muskoka and in Simcoe. The idea of doing something else, like some kind of screening for people that arrive, I think that is something that a facility can choose to do, and I would suggest it probably be more on the basis of symptoms, asking people if they have symptoms to please self-identify and not enter. I've seen that kind of signage all along at grocery stores, for example. Not active screening where you ask people, but the passive screening with signage. But an agency certainly can do that. They should do that for their employees. And in fact, the province now requires that active screening in workplaces. But that is an option. I'm not personally considering trying to make that mandatory myself, at least not at this time.
Okay. And just looking further down the road, I mean, this is 2 months away, but, Christmas is the next kind of holiday season where people will be looking to get together again. Just based on the track record of where things are at right now, do you think that we could be looking at a similar situation at Christmas as we had at Thanksgiving?
I think it's possible. Our first wave, if you think about its duration, it was really from March till June. It's essentially 4 months. I think it's entirely possible that you could be into a prolonged wave like that would impact on Christmas. I think it'd be wiser to plan for that, to think through as households, how are you going to manage that? Under those circumstances, we'd still be recommending people stick to their household only. I know that will be very unpopular and certainly a hardship on us all. It would be a hardship on me. Absolutely. We love getting together with family at major holidays, including Christmas, so it would be a hardship. But I think it'd be wiser for people to think through how would you plan for that. Wiser for municipalities to think through community events related to that and whether or not they should happen or how they'd have to be modified so that you aren't violating the gathering restriction of 25 people outdoors or 10 people indoors and the physical distancing that everybody will need to do. So there's a high likelihood that it could impact on Christmas, and I acknowledge that it would be a hardship.
Thank you very much.
You're welcome.
Thank you. Alexandre Bergeron from La Clay, do you have a question for Dr. Gardner? Okay, we can come back to you. How about Mark Claremont from Muskoka today?
Thanks. Dr. Gardner, you sound very calm and very measured in your comments. And
Thank you.
some people depict that as quite reassuring there. I just wonder, how many cases will it take for you to panic? And are you losing any kind of sleep yourself personally over the rising tide of this pandemic?
I am absolutely very concerned about the increasing numbers, the trend, not just the numbers we see. I'm worried about what we don't see. So I am concerned that the transmission that's happening now, you won't see it for 2 to 3 weeks. So anything that we do now to turn this around will be delayed in its impact by at least that long. So I'm very concerned. I indeed will lose sleep, have a lot of concerns on my mind much of the time. I think, though, that it's really, really important as a local health leader to convey clearly what's happening, and it's easier to convey it if you're calm. I cultivate that because I need to be an effective communicator about what's happening. So it's important that I'm able to do it in a clear, calm way, so that we can act on it in a rational way. We need to all take to heart what's happening and fully understand it, and fully understand the control measures that we all need to implement to bring this under control. So if I'm coming across as calm, it's because I think it's the best way to be able to clearly communicate to people what they need to know.
But do you ever feel like yelling and screaming at some of the people? The inaction, I guess, maybe is the way to describe it. As some people across the country, other health officials have spoken of very vociferously, and politicians have done the same too.
Well, I think we all have our own style of communication. I tend not to go there readily. I would prefer to be understood clearly, and I feel that taking a rational approach is most likely to succeed. I indeed can become frustrated when I learn of people that aren't abiding by the control measures. I see it as a very challenging thing to get everybody on side and getting everybody to do what they need to do. I know that messages alone are of limited impact. It's also the rules that the province puts in place that's particularly effective. For example, I noted early in the spring and into the summer, when we were starting to recommend that people wear face coverings and masks in indoor public places, that maybe 30% of people that I saw when I was shopping were wearing masks. And after I issued my letter of instruction requiring that people mask, it went up to 100%. So I know that messaging alone only has a limited impact. It's also the requirements and the orders and the directives and the law, essentially, that is most effective in the end in changing what we do. And therefore, I'd rather we identify what we need to do and put it in place rather than use a lot of emotion in my tone with regards to messaging.
Okay, thanks a lot.
You're welcome.
Thanks very much, Mark. Erica Engel from Barrie today. Go ahead.
Hi, yes. Going back to the dashboard, how close are we to being in the red for all 4 indicators?
That's a good question. If we continue to see an elevation in our cases, if we continue to see an elevation in our reproduction number, if we continue to see an increase in our percent positivity, then that would tip us. That would tip us into the red. And we are growing at this point very rapidly in cases, so it's possible that you could be there within a week.
Okay, and further to that, you indicated that yellow needs attention.
Mm-hmm.
What attention is it getting right now?
Well, it's certainly getting all the attention we can give it. Our full resources are put into the COVID response, but it needs the attention of the public. It needs the attention of all of us. We all have to be aware that this is happening, and we all have to put into practice distancing measures, the control measures in our lives, limit ourselves to our households at this time, not engage in parties, for example, that can lead to transmission that affects multiple households and multiple schools or multiple workplaces. It takes individual attention as well, and it will take also the province proceeding with more control measures as well. So it takes attention at that level to also bring this under control.
Thank you very much.
You're welcome.
Thank you, Erica. Allison Brownlee from Muskoka Region. Go ahead, please.
Thank you. One of the issues we've seen of concern in the community as well is COVID fatigue. How big of a threat is COVID fatigue, and what advice do you have, particularly for people in Muskoka, when it comes to overcoming that fatigue?
It's a huge challenge. This is unprecedented in our lives to have something like this happen. It is the pandemic of the century, after all, so nobody in living memory has had experience with this, and it's going on a long time, and it will go on for a long time, and we're just not used to that. We're not used to having to restrict ourselves socially or economically with our work for months on end. We're not really well equipped as beings to be able to do that well, so that's an enormous challenge, and therefore, we're vulnerable to having these resurgences happening again. And once we bring this one under control, we'll be vulnerable again to it coming back into existence because of fatigue and because it's just so inherently difficult for us to not socialize the way we normally, naturally do.
So what advice would you have for people to try and overcome that?
Well, I think people, despite their natural inclination, have to fully realize the challenge that we've got and fully face it, and identify who are their key supports. If you have a household, that's your main support. If you live alone, you need another household. People, this time around with this second wave, those who live alone need to adopt another household that they could trust to overcome their loneliness. It would help for us to think about those we know in our lives who need us to reach out to them in a safe way, and that can be done through distance communication means like Zoom meetings for family members and that kind of thing. And then there's other alternatives as well, like that. Know that it's possible to go for a walk, physically distancing with a friend who's not a household member, that is something you can do, and identify what are other things you can do that are still safe and healthy, that allow you to have some engagement with people. It was easier in the summer. In the summer, the weather made it easier to do that kind of outdoor activity, social activity. You could potentially have people in your backyard and still be physically distancing. I think we're really in for a challenge as the weather gets colder. It's going to limit our ability, and I guess we're going to have to get better at overcoming the weather to be able to take advantage of the outdoors as a way of socializing and being engaged with people that aren't part of our household. But I just keep coming back to it. No matter what, it will be a challenge. People need to know up front that it's going to be a challenge and prepare themselves emotionally for that.
Thank you very much. And just a quick follow-up too. You've mentioned Remembrance Day previously. As we get closer to it, any additional recommendations yet or direction on how communities should be honoring Remembrance Day this year?
I anticipate that the province will come out with specific recommendations on that, but they'll be in keeping with the general principles of limiting gatherings, living outdoor gatherings to 25 or fewer people, and setting things up so that there's physical distancing at those gatherings. So that would be up to those who organize the events and municipalities to do, and for us as a health unit to foster that it be done that way, and to set up enhanced means for remote participation using the internet as a way for people to attend, or television, and once again for people to use the kind of two-way communication that now exists electronically.
Perfect. Thank you very much. I really appreciate it.
You're welcome.
Thank you, Alison. Roger Klein from CTV, do you have a question for Dr. Gardner? Okay, let's go down to Alexandre Bergeron from Laclais. Do you have a question? Okay, and let's just check in with Adrian Presidia at MyFM. Do you have a question, Adrian?
Yeah, just a quick clarification on something regarding Simcoe Manor and Bradford Valley. I just wanted to know about what if you look up, where did I put it now? They're considered units.
Mm-hmm.
There's, they say there's 3 or 4 residential units. How are the units defined? Are they buildings? Are they rooms? Apartment? I'm wondering how things are transmitting so quickly.
Well, for one, Bradford Valley only has the 2 staff members, so they haven't had transmission wise at the site. So that's a very good thing. When it comes to Simcoe Manor, they have multiple units. And in order to prevent further spread, we're doing something called cohorting, which is limiting staff to be working only in one location within the complex rather than moving throughout the complex. With movement, there's a potential to move infection from one location to another. So a classic strategy in dealing with that is to cohort. That requires more staffing. It requires a lot of administrative control to have that in place. And it requires a movement of residents as well, so that those who are cases are kept away from those who are not. Hopefully that's answering your question. Is that getting at the spirit of your question?
Well, not quite.
Okay.
I've never been in the building, so I'm not familiar with how, what a unit would be considered. Is it a building, or is it how they're housed within a building?
You know what, I would prefer, as I have never actually been there myself, I would prefer to get back to you. I've seen a floor plan that shows them as separate locations, but exactly how that's constructed, I would have to get back to you.
Okay.
Yeah.
Can I ask something else then? Just another, when you have one person at a long-term care facility come down with the virus, it's considered an outbreak. But when you have someone in a school come down with the virus, it's not. I'm just wondering what the difference is.
So it's actually much more standard to need evidence of transmission on site which usually means more than one case, to be considered an outbreak. So prior to COVID-19, that was our approach with long-term care facilities or hospitals, that generally you needed more than one case or evidence that had transmitted on site, right? If you had a single case, but there was no way that they'd been there and they hadn't left the facility, they couldn't have got it out of the facility, that's evidence it transmitted on site. That would have been the standard approach. But with COVID-19, the province chose to be more precautionary with long-term care facilities, with congregate settings, healthcare settings, and so they designated a single case as defining an outbreak in those situations. And so with schools, they decided to take the more typical approach of requiring more than one case with evidence that there was a link between the case, transmission between the cases, to define an outbreak. And I think that's wise, because we've seen many, many, many more situations where there was an exposure but no transmission versus transmission in the school environment. Students, young people are less susceptible to this virus. They're less likely to transmit this virus. So the school environment is a less vulnerable environment, and therefore the province made the choice they made about it.
Okay, thank you.
You're welcome.
Thank you. Okay, is there anyone else on the line that we may have missed? Very good. Okay, thank you for attending, and have a good afternoon. See you next week.
Goodbye, everybody.